My name's Katriona. I'm a physiotherapist based at Central Health Physiotherapy in London. I work between our Chancery Lane and St John's Wood branches. So you may have seen some of my colleagues in the past at some of the run-through events as we've been giving out physiotherapy advice and massages post-race. I'm coming to you today from my own kitchen due to COVID-19 restrictions in the UK, which for me is a little bit funny as normally I treat my patients face to face, but in these times I'm doing lots of video consultations. I have a special interest in treating runners, being a long distance runner myself, and I also have extensive postgraduate training in assessing and treating running related conditions. I've been asked by Run Through as part of their Move in May campaign to talk to you today about Shin-Splints, or what we as physiotherapists call medial tibial stress syndrome. So what are Shin-Splints? Well, Shin-Splints is quite a vague generic term. It's a very common running related injury, and it actually refers to bone stress response in the shin itself. Usually when we gradually load our tissues, whether that be muscle, ligament or bone, the tissue will adapt to this load and get stronger. However, in the case of Shin-Splints, what tends to happen is the load placed upon the bone is greater than its capacity to be able to adapt to that load and remodel, so it becomes overloaded and it develops a stress response. Usually this happens due to some kind of training error, whether that be a sudden change in your volume, your intensity, the surface you're running on, your footwear, or essentially just too much too soon. Your bone capacity can also be influenced by your genetics, your diet and nutrition. So for example, if you're lacking calcium or vitamin D, if you're female, your menstrual status, and also if you take certain medications, particularly things like steroids. Risk factors for Shin-Splints include being female and having weakness in your hip abductors, which is the glute muscles on the side of your hips. If you've previously had Shin-Splints in the past, that's a risk factor for getting them again, unfortunately, and a few years running experience, or even if you have a high BMI. It starts with what we call periosteal inflammation of the surface of the shin bone, and it can progress into a full-blown stress fracture if not managed properly. So usually my patients describe like a diffuse ache along the surface of the shin bone, which comes on with impact and goes off with rest. It can vary quite significantly person to person. Sometimes it starts immediately with impact, sometimes it builds. But the key thing is that it stops when you stop the impact. Main thing to look out for if you're suffering with Shin-Splints is firstly that the pain isn't in a specific localized part of the bone, and that outside of impact activity it settles down. Because if you're feeling it day to day and at rest and it's waking up at night, then I would have a high suspicion that you might actually have a stress fracture. So it's important for people like me who are physios to be able to differentiate between a stress response in the bone and a natural stress fracture. So I've been asked to share with you 5 common questions I commonly get asked about Shin-Splints. So number 1, what's caused it? So for me this is a bit of a heart sink question, because like most running related injuries, Shin-Splints are multifactorial. It could be a whole host of things that have caused it. Most likely it's some kind of training error, as I mentioned earlier, so a change in something, too much too soon. In terms of running styles, we know that having a narrow running gait or a crossover running gait can put increased load on your shin. There's also some evidence to suggest that having a cadence of 164 or lower is associated with shin pain. Now, if you don't know what cadence means, it means how many steps per minute you take when you're running. Now, this is not something to get too caught up with. You know, the evidence is very sketchy about cadence these days, as there is such a variation person to person. But there is some stuff coming out indicating that lower cadences could be associated with extra load on your shin. We also know that impact loads on the shin increase with speed work, and if you land heavy, so hearing that noisy runner coming towards you, they're going to have a lot more load going up the chain. And lower body weakness could play a part, tends to be common in runners who don't focus on strength and conditioning outside of their running. Also, if you have inadequate rest and recovery, so not allowing that bone time to sort of remodel and adapt in between training sessions. And it could be a whole combination of things, so it needs to be assessed and treated on a case-by-case basis. It's not a one-size-fits-all approach. Number 2, can I still run with Shin-Splints? So this varies person to person. It's all about the behaviour and severity of symptoms. Some physios will argue that you're prolonging the problem by letting someone continue to run. But you know, it's difficult as a runner because you don't want to stop running, and it's my job as a physiotherapist to keep you doing what you love doing. And you know, there will be times where I have to suggest that you take a break, but ideally I'd like to work with you and keep you running as much as possible. So I tend to let my patients continue to run as long as they modify the intensity of their runs, their symptoms stay below sort of a 2 to 3 out of 10 whilst running, and the symptoms settle immediately when they stop, so they're not having pain at rest. If there's any pain at rest or outside of running with usual standing, walking, weight bearing, daily activities, I usually will recommend a period of relative rest, whether that's just 1 or 2 weeks break from running, until I can get my patients sort of tolerating impact again safely. Okay, so number 3, is it my footwear? Do I need to change my running shoes? This is a really common question, something I always get asked. So if there's a sudden change in footwear, that could play a part. I mean, if the shoes are really, really old and out of date and not supporting you properly, then that could also be a reason. And also we know that shoes with very cushioned heels encourage that kind of heavy heel strike pattern, which increases load on the shin. So, you know, there's different shoes which will affect how you run, for example. But I always say form before footwear. I am more likely to address someone's sort of strength or balance deficit and play around a little bit with how they're running and their training program, as opposed to actually recommend a change in footwear, unless there's something really obviously wrong with their footwear. Okay, so number 4, will massages or stretches help? Well, not necessarily. From experience, I find people that have a lot of tension in their calves or in their shin through the tib-ant muscle sometimes respond in the short term to some gentle stretches or a little bit of soft tissue work or foam rolling, but it doesn't work for everyone. There's no harm in doing it if you feel like it helps your symptoms. So it's not something I specifically recommend, but it's also not something I don't recommend at all. And then number 5, I've stopped running for several months due to shin pain. How can I safely return to running? Well, usually when people stop running, it's because the pain has become too much to tolerate with running. So what I would say is, ideally, you should have gone through a decent sort of strength and conditioning or rehabilitation program to address any weaknesses and control deficits you might have. You should be pain-free at rest and be able to go about your day-to-day life without any symptoms. And you should be able to tolerate, you know, short bursts of plyometric activity, a bit like, you know, running on the spot for a couple of minutes. One of the tests that I use in clinic to see if people are safe to return to running is that they should be able to do 25 single leg hops on the spot, pain-free, and if they can achieve that, then that is my marker for them to start a return to running program. And that being said, going back to running, it shouldn't just be, you know, return back to that normal 5k that you were doing a few weeks ago. You should grade back into it slowly, maybe follow something a bit like the couch to 5k. So Shin-Splints are a tricky one to manage. Really depends on the patient and their specific symptoms and how they behave. It's not a one-size-fits-all approach, I'm afraid. I've been asked to share some tips for people with shin pain pre and post running. I tend not to recommend static stretching pre-running because there's some evidence against that. But I don't mind my patients doing a more dynamic stretch to warm up. And I'm just going to share with you now what I do before I go for a run. It sort of just mobilises all the joints you need for running and also just gets those muscles ready a little bit. So just watch me. So I'm going to come into a high plank position. From the high plank, bringing my foot up to the opposite hand. And then you can just rock forwards and back here, so it's just a nice mobilising of the hip and the quad and the ankle. And now I tend to be quite stiff in my back, so I add a rotation in here, and come back, and then I alternate. So to the other side, and again, rocking in and out. So I might spend a couple of minutes doing this before I go out the door. And then I'll come back into a downward dog, so I wouldn't hold a static downward dog, but just a nice pump out of the ankles, again getting the calves fired up, getting the ankles mobilised, getting the back mobilised, and then you're all good to go. Okay, so So during running, if you're suffering from shin pain, I would suggest thinking about landing soft on your feet. Think about maybe shortening your stride. Try and make as little noise as possible when you're landing. So if you find yourself running like this, then that's a lot of impact. So what you might want to do is take your headphones out, have a good listen, and try and land a bit more like this. Okay, so that will help reduce some of the impact forces. And also try and reduce the intensity of your runs by avoiding too much speed work or interval training. Post-running, happy for my patients to do some slow, static, sustained stretching, but they should really tailor it to which muscles feel tight, whether that's your quads, your hamstrings, your glutes, calves. If the shins are sore, then I'd recommend icing them for about 20 minutes. But please avoid taking anti-inflammatories because there is some evidence that it affects bone healing. And obviously with Shin-Splints, we are talking about a bony injury. I'd also recommend fitting some strength and conditioning in to your training routine once a week. Ideally, you want to focus on all the muscles that you need for running from the core down. So core, glutes, quads, hamstrings, calves, foot muscles, everything. Twice a week is sufficient to do this, and I would maybe include things like Bulgarian split squats, deadlifts, step ups, calf raises, those kinds of things. Now I mentioned earlier hip abductor weakness. I'm going to show you an exercise that I commonly prescribe for that, which is a great exercise. So what you need is a resistance band, and if you don't have one of those, you can use a pair of tights, because if you tie them up tight around your ankle, it should give you some resistance. Otherwise, you can order these on Amazon. And what you're going to do is put it around your ankles and bring your feet just slightly wider than hip width. You're going to come into a mini squat position. And now during this exercise, your feet are not going to come any closer than this. So you're keeping that tension on the band, and then you're just going to side step, so really mini side steps. We call this a crab walk because crabs walk sideways. And once you reach one end of the room, you're going back the other way. So this is something you won't need to do for very long before your hips get tired if you're weak. So I'd recommend maybe 10 steps in one direction, 10 in the other, and then just repeating until you feel like you've worked your hips a little bit on the side. The other thing that's good for shin pain is calf strengthening. Now, traditionally, a lot of people do calf strengthening with knees straight, which works mostly your gastrocnemius muscle, which is the bigger calf muscle. Now, I tend to find in my patients with shin pain that they actually are weaker in their soleus muscle, which is the shorter of the two calf muscles. And the way you can target that one is by doing a heel raise with knees bent and then working in that position. Okay, so I have some weights at home, so I would choose to load that with weights. You don't necessarily have to do it with weights, you can do it body weight, you could do it on the edge of a step, so you go through a bit more range, which will make it a bit more challenging, and you can also do it on one leg. Okay, so just to recap, takeaway messages. If you have pain more than sort of 2 to 3 out of 10 whilst running, and more than 2 to 3 out of 10 whilst running, rest it for a few weeks and slowly grow back in. Try dropping the intensity, speed, and try shortening your strides and landing softly whilst you're running. Pain at rest outside of high impact activity is a little bit of a red flag and should need some further investigation. And try and keep your core and low body strong by adding in some strength and conditioning into your routine twice a week. So that's it for Shin-Splints. I hope I've answered all your questions, and feel free to get in touch with me if you have any further queries, worries or concerns. I'll be back again next week for episode 2. Bye.